Hello everyone, welcome back to our class, and for today let's talk about memory and cognition. So I believe you already learned about memory in your previous introduction to psych course. No, memory is an important cognitive skill and function in our bodies. No, as human beings, this will help us communicate with other people as well as have meaningful interactions with others and help us function and think well. Memory commonly refers to the storage and retrieval of information. Information processing models of memory assume that information flows through a series of stages on its way to the permanent storage in memory, or called as long-term memory. So there are actually three stages of memory. Now we have encoding, storage, and retrieval. Encoding is the first step of creating new memory. Okay, this is when we started to learn something, read something. No, it allows the item of interest to be changed to a construct that can be stored in the brain, mentally processing information so it can be entered into memory. So we have also the storage, the second stage of memory. This is holding the information for a period of time in short-term or long-term memory depending on the importance, attitude, or experience. We also have retrieval. This is accessing or recalling memories when needed. Okay, this is when the point or the time we're in, if we need something or we are trying to remember something, no? Okay, we're trying to look on that storage or library of memory we have, and then we recall it, and then we retrieve that memory that we need on that particular situation or instance. Memory is today defined in psychology as the faculty of encoding, storing, and retrieving information. So that is the definition of memory in psychology. So for psychologists, they have found out that memory includes three important categories. These are sensory memory, short-term memory, and long-term memory. Let's discuss that later. Okay? So these are the samples, or these are the different types of memory. So we have sensory memory. So this connotes a very large capacity that lasts up to 1 or 2 seconds. No? If we can smell something na parang adobo lagi yan, or it smells like perfume, like Bulgari, or it smells like Chanel, okay, or it smells like pepper or basil leaves. No, it gives that a sense na, wait, it smells like this, no? Or kapag meron tayong nakita, no? Or it looks like uh, an artist, it looks like Ariana Grande, or like that, no? It gives us an instinct that we already knew that, no? Through our senses that have experienced it before. So, we also have short-term memory. So these are small that can compose of 5 to 9 items in capacity. This will last to 15 to 18 seconds. We also have long-term memory. So this is an unlimited capacity. Okay, and again, just like what is your name? What is your birthday? Those are example of long-term memory, no? It will last indefinitely, no? So again, sometimes it's really important for us to store that memory we just learned to that long-term memory. So again, new synapses, also neurons helps in the formation of long-term memory. According to the information processing model proposed by Atkinson and Schifrin, information is processed in a sequence of steps. Okay, so actually they are in different steps, no? Ayun, so sensory memory, going to the short-term memory, and going to the long-term memory. But still, they are classified as different types of memory. Okay, so first, the sensory input from your senses: eyes, ears, mouth, okay, hearing, seeing, smelling, touching. No, those are different sensory input that will catch by the sensory memory. And by attention, it can lead or it can go to your short-term memory. So also, through this short-term memory, no, it can go to your long-term memory, no, through retrieval process. Okay, the short-term memory holds limited quantities of information for limited periods of time, and the long-term memory can hold unlimited amounts of information for unlimited period of time. The information that does not move to the next stage for processing will be permanently lost. So again, it's important, especially for important and significant information or highlights. No, it's important for it to go in our long-term memory, or else it will be deleted or it will be forgotten. The final destination for information in the Atkinson-Shiffrin model is the long-term memory storage or long-term memory. Okay, short-term versus long-term. What's the difference in short or sensory memory? So, short-term memory is an intermediate memory store in which limited amounts of data can be held for a limited amount of time. Without further processing, such information is permanently lost. So, what happened to us yesterday? Now, some of it we cannot remember it or we cannot recall it, but some information or some highlights that really strike us or have an impact to us, it can be converted to long-term memory that can last through years and years and years. Long-term memory is a memory store in which apparently unlimited amounts of data can be held for an unlimited amount of time. So like, what's your birthday? What's your blood type? Who is your first crush, or sino yung ex ninyo, or sino yung mga naging boyfriend or girlfriend ninyo, no? So those can be stored in your long-term memory. So those are part of our memory storage that is unlimited. No? It can go for amount for series of years. No, it will not be forgotten once it goes already to your long-term memory. Sensory memory naman is an initial stage in memory formation in which large amount of data can be held for very short period. So when some stimuli is being sensed or being did, or how can I say it, kapag na-detect ito ng ating brain, okay, then some of it might actually go to your short-term memory, and some of it might not be or might be rejected or might not go to our short-term memory. So important sometimes na yung mga information that became crucial to us or have impacted us will go to our short-term memory, and others that might find irrelevant, no, it will no longer go to our short-term memory, and from short-term it will go to our long-term memory. So sinasala, filter out siya through different stages sa model ni Shiffrin at ni Atkinson. Okay, di ba? Makikita natin dito paano siya filter out. So paliit na as it goes to the long-term memory. Okay, we have types of long-term memories here. We have declarative memory, and we have non-declarative memory. So yung declarative memory, these are explicit, no? Explicit memory, no? An explicit memory for semantic and episodic information can easily be verbalized. Ito yung mga implied na, no? So, or declared already. These types of memories are declarative in the sense that they can easily be described in words or declared. No? So, hindi siya abstract, no? Can easily be declared. What is it? Ano ba yun? And non-declarative naman are implicit types of memory that does not require the conscious or explicit recollection of past events or information, and the individuals is unaware that remembering has occurred. So, perhaps may instances na hindi nyo talaga maalala saan na particular yon, but you can remember it, no? In an implicit way, what actually that is, no? Meron kayong mare-remember, pero may pagka-vague siya, hindi siya klarong-klaro, or you cannot describe it into words, no? That is the non-declarative or implicit memory. So, yun yung dalawang types ng long-term memory. So, sa declarative memory, no, declarative or explicit type, no, may tatlong types of memory under dito. So ito yung semantic memory, episodic memory, and procedural memory. So let's discuss them one by one. Semantic memory contains basic knowledge of facts and language. Okay, like who was the first president of the US, or what is a bagel, no? So ito yung ito yung may mga questions na basic knowledge or facts, language, what is the term, what is the English word for toothpaste. No? Like that, no, you actually know it because you can utter it in words. Episodic memory naman relates to your personal experience. You use your episodic memory to remember certain episodes or events in your life. What you ate for breakfast that night, or who was your first puppy, or I mean, what was the time of your first puppy. So ayun, so dates, no, events that happened, that have occurred. Procedural naman stores information about motor skills and procedures such as riding a bicycle using a software program or cooking your favorite meal are often quite difficult to describe verbally, but you can easily demonstrate or perform, or how to drive a car, no? So you cannot actually, you cannot actually, how can I say it? Hindi mo siya madaling ma-utter into words, or but you can actually do it kapag once pinagawa sa'yo, alam mo kung ano yung kailangan mong gawin. Can you get the point of it? So, procedure, no? Alam mo yung different steps, how to get in that place, no? What to do in this situation kapag merong nahimatay or kung ano man, di ba? So, ayan. So, alam mo siya through motor, and also the procedures involved, yung action na kailangan mong gawin. You can know it, no? Without yung talagang kailangan mong alamin yung terms, alamin mo kung anong kailangan, alamin mo kung ano yung mga specifics niya through words or verbal knowledge. You know it, no? Kapag you are working out or in the gym, alam niyo kung ano yung kailangan yung gawin. Kasi nare-recall na siya, no? Kung ano yung kailangan procedure na kailangan gawin in every set or in every workout activity you have. Okay? So, yun yung procedural memory. Usually, performance motor ito. Okay. Let's go to implicit or non-declarative memory. So, under implicit, we have procedural memory, we have associative learning, and non-associative learning. Okay, again sa implicit or non-declarative, no, ito yung mga terms na quite abstract and you cannot say it into words. Okay? So, kasali din dito yung procedural memory. Ay, okay. Okay, I'm sorry, no? So, yung procedural memory para hindi siya included sa explicit, no? Yung procedural memory belongs to implicit type of memory or non-declarative type of memory. So, under here is we have procedural memory, associative learning, and non-associative learning. So, again, just to reiterate it to you guys, no, explicit is declarative type of memory which includes semantic memory and episodic memory only. Kasi yung procedural, hindi natin pwedeng masabi na kailangan ganito. No? You cannot utter it sometimes into words. No? How to do this or how to do that. No? You know already what to do. If you're like a lifeguard, no? Yung functions mo or yung procedures na kailangan dyan. Associative learning naman, ito yung may classical and operant conditioning. No? May sometimes when we are trying to unlearn a certain behavior of doing it through reward and punishment given towards because of doing or because of not performing that specific stimuli, no? Like that. So sometimes we can unlearn certain behaviors and it can be stored in our memory. Non-associative learning is an habit. This involves habituation and sensitization. Okay. So let's proceed to the different brain parts that involve in memory formation. So the hippocampus is the part of the brain and the limbic system that is responsible for memory. So again, please take care of your hippocampus. No? Its activities include forming memories, organizing memories, and retrieving them when needed. When your hippocampus is impaired, you'll have difficulty forming new memories. If your hippocampus is damaged in both halves of your brain, you can develop complete anterograde amnesia. Okay, later on we'll discuss different types of amnesia. Okay, so causes of memory loss or damage are we have head injuries, alcohol use, trauma, or stress and anoxia. So, ayun, ito yung mga causes of memory loss or damage. Again, alcohol, too much alcohol can really diminish your IQ level. That is a fact, actually. And trauma or stress, no? Sometimes, kapag we are in a stressful moment, sometimes our brain will repress, no, yung mga certain memories natin na ayaw nating ma-remember na. And also for people who have trauma, no, it's like our defense mechanism, no, that really prevents us from remembering and revisiting what actually occurred that we don't want. Yung anoxia naman, class, ito yung depletion of oxygen levels that can also affect your entire brain. That can then lead to memory loss. Okay, so it is actually isn't severe enough to cause brain damage, and the memory loss can be temporary. Head injuries, of course, kapag nabangga kayo ng kotse or car accident, kung ano man, kapag nabagok yung inyong ulo, of course, it will can lead into different head injuries like stroke, tumors, infections, and hence it can damage also your brain, specifically your hippocampus. Okay, so temporal lobe, no? Ito yung part, yung lobe of the brain responsible for memory formation. This includes the hippocampus and the surrounding structure. Like what I mentioned, no, yung different parts that are included inside the temporal lobe, they work together hand in hand. So, ang hirap sabihin na yung isang specific part lang yung may ganitong function. Kasi yun nga, they can go together. They work together to deliver the function. So, some of them might have similar functions. So, they work like a team, no? So memory can be conceptualized as a series of stages including sensory memory, short-term memory, and long-term memory. So patients with damage to the medial lobes experience anterograde amnesia. This is the inability to form new declarative memory. Okay? So hindi kayo makapag-form ng bagong memory. Long-term potential LTP first observed in the hippocampus that might provide a basis for the change necessary for forming long-term memories. Okay. These are the parts responsible for memory. We have the encephalon. They transfer information from long term, from short term to long term. Association cortex, no, and this helps encode long term memory and retrieves long term memory. We also have prefrontal cortex. These are responsible in episodic memory and short term memory. And we have also basal ganglia. This involves in procedural or implicit memory. Okay. Okay, what is the effects of stress in our memory? The experience of trauma, like what I mentioned, is widely believed to influence memory. Freud believed that traumatic memories can become so inaccessible that they are essentially lost or repressed. In contrast, memories of trauma in post-traumatic stress disorder are often unusually vivid and intrusive. Okay, so, ayun. Sometimes, no, paulit-ulit ito sa atin, kaya tayo nagkakaroon ng PTSD if it will last for 6 months, no? Post-traumatic stress disorder, when a person is being harassed or ostracized or being or experience a physical abuse or sexual abuse, no? Memories of trauma can be so um, intrusive, no? To the point na the person is no longer working or being psychologically uh, functioning well, no? And it is vivid, no? Minsan may mga situations na it remembers or it does gives that notion that it happened to us, no? Nabibigyan tayo ng parang flashbacks, no? Ito yung fearful part for people who have PTSD, no? In certain instances, sometimes they recurred those experiences that happened to them. They can remind, or they are being reminded not just of the situation, pero kapag may nangyari sa kanila na similar or associated with what happened to them on the past, then it's quite scary, no? And yun nga, talagang kailangan din talaga ng psychological intervention counseling, and psychotherapy. In addition to its impact on the hippocampus and amygdala, stress affects the functions that is normally carried out by the prefrontal cortex, which includes coping skills, decision making, planning, and multitasking. Okay, yung Broca's area is known as the motor speech area. It is the near the motor cortex and utilized in speech production located in the inferior frontal gyrus. We also have the Wernicke's area. This is the region of the brain that contains motor neurons that is involved in the comprehension of speech. So ito, yung Broca's area is kay Paul Broca siya galing. Siya yung naka-discover ng I think siya yung naka-discover ng area na yun sa brain for speech production. Yung Wernicke's area naman, it allows us to comprehend and understand speech. Aphasia is difficulty in understanding speech. No? Agnosia is a rare disorder characterized by an inability to recognize and identify objects or persons. Apraxia is a neurological disorder characterized by the inability to perform learned familiar movements on command, even though the command is understood and there is willingness to perform the movement. Ataxia is typically defined as the presence of abnormal, uncoordinated movements. So take note of these terms, okay? These are disorders, cognitive and motor related disorders. Let's now go to memory disorders. So memory disorders are disorders of cognition, the ability to reason, remember, make decisions, and communicate. So symptoms may include confusion, inability to communicate, language problems, paranoia, memory loss, trouble with reasoning, wandering, or getting lost. So sometimes people who age, no, they already have that progressive memory disorder na hindi na kayang i-reverse pa. Especially this happens on Alzheimer's disease, and dementia, delirium. Okay, let's discuss those different memory disorders. So dementia, ito yung umbrella term for other memory disorders. Dementia is the name for the group of brain conditions that make it harder to remember, reason, and communicate. Dementia is a descriptive term or syndrome rather than a diagnosis. So again, it is actually a syndrome and not a diagnosis. So sometimes we can connote dementia, no, to other types of diseases because yun nga, nangyayari din ito sa mga diseases. So a syndrome is different from a symptom. Okay, a syndrome is a group of signs and symptoms that occur together and characterize a particular abnormality or conditions. So group of signs na siya and symptoms, no? Yun ang syndrome. Okay? Different siya sa symptoms. Alzheimer's disease, no? Brain illness that can happen usually in older adults, but it can also happen as early as age 40. It is the most common cause of dementia that happens when the nerves in the brain become tangled, form plaques, and lose their connections to each other. So, may mga brain scans like MRI brain scans. Sometimes makikita na yung mga gyrus, no? Is medyo hindi siya intact. Kasi kailangan kasi na may pagkadikit-dikit sila. Okay? Yung mga gyrus, no? For just to consider it as a normal functioning brain. Okay, we also have frontotemporal dementia. It's a common cause of dementia. It's a group of disorders that occurs when nerve cells in the frontal and temporal lobes of the brain are lost. This causes the lobes to shrink, no? Frontotemporal dementia can affect behavior, personality, language, and movement. Next is we have encephalitis. It's the inflammation and swelling of the brain. This leads to changes the, in the neurological function that results in mental confusion and seizures. No? The viruses are the leading cause of encephalitis. Next is we have vascular cognitive impairment. This is the second most common form of dementia after Alzheimer's disease, caused when there is a decreased blood flow, damaged brain tissue, and the blood flow to brain tissue may be reduced by a partial blockage or completely blocked by a blood clot. We also have mild cognitive impairment. It is an intermediate state between normal thinking and memory and dementia. Patients with MCI can have difficulty with memory, language, thinking, and judgment that are greater than would be expected for their age. people with MCI may be at increased risk for developing Alzheimer's disease. Okay, those are some memory disorders, and now let's discuss about amnesia. So, amnesia is, of course, another type of memory disorder. Amnesia is a type of memory loss that affects your ability to make, store, and retrieve memories. So, we have actually two types of amnesia, two general types of amnesia, but there are a lot of types of amnesia. Okay, first general type is we have retrograde amnesia. This is when a person loses existing previously made memories. This type of amnesia tends to affect recently formed memories first, then older memories such as memories from childhood are usually affected more slowly. Conditions such as dementia cause gradual retrograde amnesia. So what happens here is what you have remembered before, especially those na medyo recurrent lang or bago lang, no? Hindi nyo na siya maaalala or can be, you can be it can be find difficult for you to remember and recall those memories. Ito yung I think common type of amnesia, no? Sa mga movies, sa mga teleserye, no? Yung nakakalimutan, sino ako, anong pangalan ko, sino mga magulang ko, 'di ba? May mga ganito ng mga instances na sa mga movies. Anterograde amnesia naman, this is when a person can form new memories. If you have watched yung movie na 51st Dates, yung si Lucy, no? She has anterograde amnesia wherein when she falls asleep, she cannot remember what happened to her the previous days. But on the other hand, she knows still sino yung father niya, sino yung kuya niya, anong pangalan niya, ano yung ginagawa niya, di ba? Teacher siya doon, no? So, she can actually remember it. But yung nangyari sa kanya before the accident, okay, or before that accident, that day of that before that day of that accident, no, yung car accident, she cannot remember it. So this effect can be temporary, but for example, you can experience it during a blackout caused by too much alcohol, no? Nangyayari to sa atin minsan, hindi natin naaalala, ano bang ginawa ko kahapon? Kapag too much yung ininom ninyo na alcohol, no? It can also be permanent. You can experience it if the area of your brain known as the hippocampus is damaged, no? Your hippocampus plays an important role in forming memories, like what I mentioned kanina. We also have the term Korsakoff syndrome. This is a type of anterograde amnesia results from thiamine deficiency typically found in chronic alcoholics. So, ayun ha, careful kayo sa pag-inom-inom ha. I mean, just drink moderately and ayun na lang talaga. Just avoid drinking too much alcohol. It can really damage some parts of your brain. Okay, we also have TGA or Transient Global Amnesia. This is a poorly understood condition. If you develop it, you'll experience confusion or agitation that comes and goes repeatedly over the course of several hours. You may experience memory loss in the hours before the attack, and you'll probably have no lasting memory of the experience. Scientists think that TGA occurs as a result of seizure-like activity or a brief blockage of the blood vessels supplying your brain. It occurs more frequently in middle-aged and older adults. So it will lead to experiences of confusions or agitations. Infantile or childhood amnesia. No? This is when people can't remember the first 3 to 5 years of their life. This is a common phenomenon and is called infantile or childhood amnesia. Dissociative amnesia or dissociative field. No? This is when you have difficulty remembering important information about yourself, such as your name, personal history, or family and friends. No? Dissociative amnesia may be caused by a traumatic or stressful event, such as being in a combat or being the victim of a crime. No? So sometimes this is caused by events that happen to us, specifically traumatic and stressful events. It usually occurs suddenly and may last for minutes, hours, or days. In rare cases, it may lead for months or years. You have also PTA or post-traumatic amnesia. So most people hospitalized for a traumatic brain injury experience post-traumatic amnesia. Okay, so this occurs after a period of unconsciousness and you're awake, but you may behave and speak in bizarre manner. It's not like yourself. You may not be able to remember events from minutes or hours ago. Okay, actually, the PTA can last for 1 hour for mild trauma or over 24 hours for severe brain injury. Next is we have drug-induced amnesia. So this type of memory loss may occur when you take certain drugs, like benzodiazepines, no, sedatives, and other drugs as well. That is all for our lesson. I hope you've learned something for memory and cognition. Thank you so much for listening, guys. Have a great and wonderful day. See ya.